The Young Nurses Indaba Trade Union is rejecting the Gauteng Health Department's latest response to their plea. Health workers, including nurses, security staff and expanded public works program employees protested just a few weeks ago over the state of healthcare and the poor working conditions. The union says the feedback to their demands is unsatisfactory. Let's find out why. I speak to the union's president, Rich Sicina. Good afternoon, sir. Thank you very much for your time. Why do you find the response by the Department of Health in the province of Gauteng unsatisfactory?
Good afternoon to you and your viewers, and also as your team. Thank you for having Moyane on your show. We are unhappy, my leader, because we must on the 16th. We were actually defending workers. We are defending jobs and also defending public healthcare system in general. We are not happy because, number one, we went to Department of Health to say, because they were threatening to, they were saying they don't have money. They've been crying poverty. They were saying we do not have money. As a result, professional nurses who have completed their community service after 4 years, they do a community service for 1 year. After that, historically, they are usually absorbed into the system. That is, they are going to be employed permanently by the system because obviously the system needs them. We are crying about gross shortage of staff with them in the system. Then this year, the department is saying we don't have money, they are going to go. The response to that particular memorandum of demand, in as far as demanding the permanent employment of those community service professional nurses, they are saying they have extended the contract by 2 months. That's where our number one. We are not happy with that because if you are extending the contract by 2 months, what is going to happen after that 2 months? Are we going to go back again, receiving calls from from our members who are professional nurses because the contract will be coming to an end? They are not clear in as far as that is concerned. What is going to happen after that 3 months? And with COVID-19 contract workers, remember, even under normal circumstances, we always complain about gross shortage of staff, gross shortage of material resources in our facilities. Then the department was given 2.2 billion when the COVID-19 started to say augment the human resource, augment the staff. Now that because they believe COVID-19 is over, they are letting go all of those COVID-19 contract workers. It's either professional nurses, enrolled nurses, cleaners, porters, doctors. It doesn't matter. They are releasing them. In their response, they are saying to us, we are only going to retain 100% of contract COVID-19 workers of certain facilities, your central hospitals, your Simja, which is Charlotte Matlege, Chris Hani Baragwanath Hospital, Kalafong, Tembisa, Helen Joseph. Then the question, why are we not happy as young nurses in that, even though there's some positiveness in that, we are saying, what about other hospitals? Because the devil we are facing is the same. The gross shortage of staff and overpopulation in all facilities across the province.
But the MEC of the Health Department of Health in Gauteng a few weeks ago said that she doesn't have the money. So for them, my understanding, for them to be able to do what you as the Young Nurses Indaba Trade Union want, Mr. Sicina, they would have to get the money, but there's no money. You don't buy that story?
We really don't buy that story because we believe in if they are actually going to let go of them, citing their reason as lack of funds. It's simply, what are they actually saying to us as workers on the ground? What are they saying to the community at large? Are they saying it's okay for anyone to go to a facility in a public hospital, for example, to go to Fosloras, Tenle and in a neonatal ICU and have your kid nursed by 2 professional nurses and they are nursing 40 neonates? Is it okay for the public to subject it to that particular substandard and mediocre? That's why we are not buying that story to say you are actually saying you are giving up. Because they were asked a few weeks ago, they were actually asked to say, are you in a financial crisis? They said, no, we are not in a financial crisis. They must come forward then and tell the public and say we are defeated, we are now giving up, there's nothing we can do. Then that is why we are saying, no, comrades, come on.
Okay.
You can do something about this.
So okay, you said they can do something about it. So what are you going to do next? Because you went out in the streets, you marched, we covered your march live here on eNCA when it happened. Now they've said to you, they've issued a response. You are not satisfied. You don't buy the story that there's no money. You want them to do more. What are you going to do next?
We are engaging. We've actually written a letter to the office of the MEC to say we need to have a round-table discussion around this. We are going to push because those in close proximity to those in positions of authority, they actually saying there is actually money, but the CFO, the Chief Financial Officer of the province, was actually given a directive to say cut that particular budget. Not necessarily that the budget is not there. That is why now we are gunning for that particular CSO and also the SOD to say they must leave if they are incompetent in those particular positions. Because deep down where we are sitting, we know we've went to different facilities in Gauteng, your Begimlangenis, your Telemukweranes, and all CEOs are saying this is what we are told. Because now what they want to do, they want to call these COVID-19 contract workers, nurses in particular, to join a certain agency, a certain nursing agency that is actually controlled in the in central office. The agency is paid by Gauteng Department of Health. They do not have money to continue with the contract or hire them permanently, but they do have money to pay a nursing agency. Come on, something is not right about the issue of them crying poverty, and we know they are corrupt. They will always cry poverty so they can align themselves.
Okay, we're going to have to wait and see then what your engagements are going to lead to. You're making a very strong case there for the fact that your members should be accommodated as much as possible across the hospital. And by the way, some scientists are warning us of a possible fifth wave of the coronavirus pandemic. So we're not out of the woods yet. Thank you very much, Young Nurses Indaba Trade Union President Rich Sicina.